Hi family, welcome to the Midwives Reality Show KE. My name is Evelyn Ngewa.
I'm Mary Nguru.
Kindly subscribe to our YouTube channel, share, comment, and don't forget to leave a suggestion.
Yes, welcome to this channel. Today we are going to have a very informative and very involving topic. That is danger signs of pregnancy.
Yeah.
It's a very crucial topic for any pregnant mother.
Yes.
Like which are our gray areas that we should be on lookout for.
Yeah. Whichever gestation.
We are capitalizing on the whole gestation. The first great danger sign is vaginal bleeding. Vaginal bleeding can occur after many things have happened. It can be caused by several things. We can just start with a simple vaginal bleed. It may occur after the implantation. After the baby has been implanted in your uterus, you may get a small spotting.
Yeah.
That is the only bleeding that we should have in the whole gestation.
Yeah.
This occurs like after a month from the date of the conception.
Yeah.
So most people, you'll find even they are not so sure whether they got their menses or they perceive the spotting as a bleeding.
Yeah.
So after that, this is the only bleed that should not worry you.
Yes.
After that, if you get any other bleed, you should always get to see a healthcare provider. E.g., you can have a bleeding after having intercourse with your partner. This can maybe because you have polyps, maybe because you're dry, or you have been injured.
Yeah.
It may be just a simple bleed, but sometimes it's always good to go to the healthcare provider to tell you the magnitude, to tell you this one you should not worry. To rule out any other cause.
Yeah.
You can also have, because probably you have fibroids or polyps or inflammation on the cervix around this point.
Yeah.
Maybe you have a disease process that is taking place, so you experience getting some mild bleeds.
Yeah.
Maybe after you need to go to the hospital, be seen, and be advised accordingly.
Yes.
Because some may mean disease that needs to be taken care of. So don't ever ignore any bleed, regardless of gestation.
Yeah.
You can also have a low-lying placenta. The placenta is just around the cervical area or the mouth of the birth canal. So this would mean if the uterus contracts a little bit, the placenta. Okay. Now, when the placenta comes to the cervix around this region, this is not the natural habitat of the placenta. So, and remember, the placenta is supplied by so many veins and is heavily or richly supplied with blood. So the placenta is supposed to be on top of or like the furthers of the uterus, the upper part of the uterus.
Yeah.
This is the natural habitat of the
placenta.
Yeah. If you look at, this is my placenta, and now this is my uterus.
Yeah.
Higher. Now, if the baby gains a lot of weight, the baby presses on this placenta, if it is on the low-lying placenta. And this may cause, as the gestation moves, this may cause, the pressure from the baby may cause bleeding.
Yeah, to the veins.
Yes. It may cause bleeding, and this can be fatal.
Yeah.
So that is why I'm saying, and without you knowing that you have a placenta previa, unless you are seen by a medical care provider.
You can't know.
You can't know.
Yeah.
So that you have an ultrasound done and you are advised accordingly.
Yeah.
So another thing that may cause bleeding is what we call placenta abruption. This can happen either you've been hit, like you can be hit or fall down, and the placenta separates before the baby is born.
Yeah.
Some people may start leaking out blood. So it's always good to seek medical advice
whenever you see any bleeding.
Whenever you see any bleeding during pregnancy. It's a key thing. The second one is severe headache and blood vision.
So basically, severe headache in pregnancy can be a sign of very many crucial things, and the main thing is high blood pressure. High blood pressure in pregnancy can cause so many problems to both the mother and the baby. Remember, when somebody has a very high blood pressure, there's a limited supply of blood to the baby, and that might hinder the growth of the baby in the uterus, and it can even bring other issues like kidney failure to the mother and so many other problems. So when you get a headache during pregnancy, not just a headache but a severe headache, don't just take a painkiller and just brush it off. It's good you be seen for the doctor or for the health practitioner to rule out anything that might be coming up. And any headache that comes on the frontal area, the frontal area is a bad sign of something we call preeclampsia. That should be a topic for another day, but headache should be a danger sign and should not brush it off. Just go to the hospital and be seen. Mary, you can take us through the next one, which is body weakness, extreme body weakness.
Yes. Extreme body weakness, anytime, even under normal circumstances, when you feel you're so tired, you're so weak, you should seek medical advice. So for mothers, it poses risk to the baby, risk to the mother. So you should always seek medical intervention. If you have that body weakness, yes, where like you are not able, generally you normally feel weak because of the pregnancy, but where you feel like you cannot get out of that bed, it's always to seek medical opinion. And also, when it's always good for mothers and the public at large to know what is your normal blood pressure.
That is something I needed to mention.
Yes. Because sometimes you see a certain midwife, you move from this institution to another with what we call a normal blood pressure. That is between,
everybody has a normal blood pressure. And my normal blood pressure can be your abnormal blood pressure. So you should know your blood pressure and your baseline.
Sure. So that at least by the time, even if it increases by 10, you can always question your care provider. Hey, for the longest time I've known myself,
I've never been there.
My blood pressure has always been around this point, because it also keeps changing depending with the situation. But at least you should have what we call a baseline blood pressure. And remember, it's you to know what is your normal blood pressure. From there, we have abdominal cramping or abdominal pains. That is our third danger sign.
Now, for abdominal pains, regardless of what gestation you are, any pain that is not at term should be taken as a danger sign. For example, you should be able to differentiate between Braxton Hicks contractions and pain that comes in between. That should tell you that something is not right. A Braxton Hicks contraction is a contraction that will come like today, maybe take a week, and then come maybe the next week. But maybe pain that comes not going, it's regular, it is like it's increasing with intensity, regardless of whether you are at term or whatever gestation you are, then you should take that one as a danger sign, because you might be getting into preterm labor. You might be having something like infection, like UTI, and those are things you're supposed to look at so that you are checked and you are managed very well.
The next one is reduced fetal movement. Reduced fetal movement, we are talking about how is our baby kicking? How is our baby kicking? You as a mom, it's upon you to know how you are the first person that relates with your baby. So you are the only person who can know, yesterday my baby kicked twice, and normally kicks after we eat. So you know the trend of your baby. And babies start kicking from 18 weeks to 20 weeks, around that point, and not rolling. When I mean a kick, you feel like a thrill on your abdomen. Because sometimes, even when mother come with a poor outcome, they still report like they were feeling kicks.
Baby has just kicked.
But
like
baby has been rolling. And rolling, a baby will continue rolling even when the baby is not there, because the baby is floating in the amniotic fluid, the water. So that is how, you as a mom, you should know my baby kicks this way, and after what moments do my baby kick, right? And from there, you are able to go to the hospital when you feel like, even after, many people will tell you, after I take something sweet, my baby kicks. Anytime I rest, my baby kicks. So if you do all those exercises and the baby either kicks, it's very low, it's always good to go to the hospital to have it confirmed that we are all doing okay. And a kick, when we talk of kicks, at least you should have more than 10 kicks within a day. At least 10 kicks, because sometimes even as the baby grows, the kick go reducing. But you, as the mother who is relating with this baby, you have a very, very great role of knowing when your baby kicks. The other one is
Rupture of waters.
Rupture of waters.
Now the rupture of waters can occur anytime. It can occur in the first trimester, it can occur in the second trimester, it can occur in the third trimester. Depending on what gestation this has happened, it is good you report to the hospital. Reason being, first trimester, generally when the water breaks, it means that there will be a communication between the outside environment and the baby inside. And remember, in the outside environment, there are so many microbes which can get into the uterus and bring so many problems like infections. So when you get such a sign like rupture of waters, it is good you report to the hospital, because the baby needs to be checked if the baby is okay. The other thing, when the waters rupture, they can come out with a cord, and we call this cord prolapse. When the cord prolapses, it means that the supply of blood, I can show an example. Where is our placenta? I can show an example. For example, the baby, inside the uterus, baby assumes any position they want, because that is their territory, right? So when the water comes out, the baby might be lying in a position whereby the cord is just ahead of the head. All right? As you can see, guys, this is my cord, and this is the head. Now the cord has come, and this is the cervix. Ideally, the cord is supposed to be out away from the head like this. But in my case of cord prolapse, the cord has come before the head. So in case, okay, when we get a contraction, remember when the water comes out, then the cord will hang like that. There will be, remember there are veins and arteries in this cord which are supplying the baby with blood and food and oxygen, sorry. So when the cord is here and the presenting part, which is the head, is compressing the veins or the cord, it might mean that the baby might not be getting enough oxygen, and this is an obstetric emergency because it's fatal. It can either make us lose our baby, and then it will not be a good thing. So that is why we say cord prolapse is an obstetric emergency. I hope I'm clear.
So from there, we have difficulty in breathing. Difficulty in breathing, the mother may be presenting with, like, you're not able to take enough oxygen. For mother to present with difficulty in breathing, must not be able to take enough oxygen for herself.
Yeah.
And remember, the mother is the person who is supposed to take oxygen for herself and for the baby. So, like, you remember, Evelyn, during COVID, we lost so many babies because mothers would come with
difficulty in breathing. Yeah.
And now that would reciprocate, baby not getting enough
oxygen.
And that way you may make the baby also get affected or get nil, which would mean the baby would succumb.
Yeah.
And so when you feel you're getting breathless or you're tiring for breath, kindly always visit a
healthcare facility so that
you're helped in time.
Yeah.
So with all those 9 danger signs of pregnancy, I hope we are walking in the right path. Most of our losses in maternity, they are preventable. If only you as a client, you play your role, me as a care provider,
I play
my role. So let's join hands and fight and have victory in this.
Yes.
Welcome.
Bye. We've come to the end of this video.